Typically, when someone has a screening colonoscopy, doctors are able to remove any polyps that they find. But in some people, that's just not possible. Dr. Emery Gorgon is a colorectal surgeon at Cleveland Clinic.
There are some type of polyps that are difficult to remove during routine colonoscopy. Polyps usually greater than 2 centimeters, or polyps that are located in difficult locations behind the fold in the colon.
In the past, patients with these difficult-to-remove polyps would need traditional surgery, removing a portion of the colon. That also meant a somewhat lengthy recovery.
Patients end up staying in the hospital for several days. They may get complications after surgery. They may need to be coming back and readmitted. With these techniques, they are outpatient procedures. They can come in the same day, have this procedure done, and go home immediately with no complications majority of the time. So compared to really a removal of the colon, it's much more convenient for patients.
This newer, minimally invasive procedure to remove complex polyps is called endoscopic submucosal dissection, or ESD, and it is part of the Endoluminal Surgery Center at the Cleveland Clinic.
We refer this center endoluminal because it is a procedure that is done inside of the intestine. Lumen means an opening or like a pipe, so it's inside of the lumen, but at the same time using natural orifice. We're doing what we refer as a surgical technique, therefore we refer these procedures endoluminal surgical procedures. It can be done either in the operating room or in the outpatient settings, depending on the patient specifics. We do different ways. In both ways, we use endoscope, flexible scopes, like regular colonoscopy, and find these abnormal, sometimes flap, sometimes mushroom type of lesions or polyps, and we inject and put fluids underneath these abnormal tissues and lift them up, raise them from the colonic lining, the colon line, and then using special tools through the endoscope, we make cuts around it and step by step chisel it away off the colonic wall. By that way, we can, in a one piece, get these large lesions completely removed.
Some very early colon cancers can also be managed this way.
I'm not saying for every cancer this is the approach. However, for very early cancer, this can be also an alternative.
Colonoscopy is recommended between ages 45 and 50 or earlier, depending on risk factors. For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.